Good afternoon. I would like to welcome all of you to our immersive session this afternoon. Some of you have been with us before, so welcome back. Others have not joined us before, so welcome. My name is Devora Coriel, and I've got the great pleasure of being the director of the Integrative Medicine Elective Rotation, IMER, at the Andrew Weil Center for Integrative Medicine. And it is through both of those auspices that we are so thrilled on a monthly basis to offer you an experience of one of the non-allopathic modalities that are presented in the rotation twice yearly for fourth-year medical students and residents. This month, we are particularly proud and grateful to welcome Dr. Jared Cruz, who is a doctor of osteopathic medicine, and Jared will be sharing with us a self-manipulation. We're particularly proud because Jared is a graduate of our elective rotation and has moved just brilliantly forward into his own career, sharing integrative principles. And during this time where we've seen the power of sharing on Zoom, Jared has developed a wonderful experience that you can give yourselves in self-care. So welcome, Jared. Thank you so much for what you're about to share with us and all the work you do to make this work available, both to your patients, to our students, and to our guests this afternoon. Thank you, Jared.
Thank you, Devora. It's an absolute pleasure to be here. I'm very happy to share something that's near and dear to my heart, my practice. And this entire series and this lecture that I've been presenting at IMER, I developed while I was at IMER. It was the best rotation that I had in medical school, and really opened my eyes to all different forms of practice and helped me develop. And so I highly recommend it if you're a resident, if you're in medical school, to reach out, go through VSAS or whatever they're doing these days, and set up a rotation. Absolutely. So today I want to share with you osteopathic self-adjustment, and we're going to dive into this a little bit. It'll be something to help with self-care, but also something that you can gift to others and to your patients. Today there's some kind of prerequisites to dive into that. And one of them is good understanding of visualization. So we'll go through a couple of small PowerPoint slides. We'll keep things informal, and we'll dive directly into practice as soon as we can. So I'm going to share this with you. And we'll jump in right here. This is really about finding health in balance. And in this case, we're talking about balance of the autonomic nervous system. So first, I just like an open invitation to connect with me anytime. If you want to do something fun together, if you just want to chat, if you're super interested in osteopathy, reach out. I'm also finishing a book, Somnus and Osteopathic Integrative Manual to a Good Night's Sleep, and I'm offering this free. If you're part of the AWCIM community, it's yours. I want to give it to you, give back to this community. It's an amazing community. So let's dive right in. There's 3 things that we'll go over today. One is understanding true living anatomy from a visual perspective, being able to dive into that and imagine it from a perspective of wholeness. Second, we're going to actually practice and have some direct experiences with osteopathy and learn how to give it to others. And third, we'll use osteopathic manipulation to help balance the autonomic nervous system. So let's dive in and start to understand wholeness. When we look at anatomy, a lot of times we see things like Netter slides. Seems cold, seems conceptual. But I just want you to appreciate and imagine what it's like if a body's to be hit on the left side of the shoulder. The intricate connections following this trapezius muscle here. Notice these beautiful striations just off of the shoulder. It connects all the way to the occiput at the top of the head, down the cervical spine, the thoracic spine, all the way to T12. In a few moments. Visualize this in your mind. We can also look at some of the postural stabilizers, ilicostalis, longissimus, spinalis, and we notice how they come together into one fascial fold, touching and holding on to the sacrum here, connecting to every rib and stabilizing the entire system. Again, we can look at imagining a car wreck where somebody falls on their left knee through the femur, up through the ilium, a vector force driving that ilium upward. And we see how it would shorten this quadratus lumborum muscle, bringing it to spasm, directly attached to rib 12, the entire left posterior side of the diaphragm. Again, breath, body, and soon we will see mind. The last thing we'll look at is a viscerosomatic reflex arch. Now, we're all familiar with the autonomic nervous system. You have your sympathetic, your fight or flight, and your parasympathetic, your rest and digest. Many of you through medical training are probably familiar with this complicated picture. I'm sure you have it thoroughly memorized. We'll make it simple. On the left here, we see sympathetics. There's a series of ganglia that come out of the spine, and all of these ganglia are little neuronal clusters. They're located right anterior to every rib head. They connect directly to our visceral organs. So imagine someone with atrial fibrillation, a recent heart attack. This brings afferent impulses back to these ganglia, causing muscular hypertonicity around that area. You can begin to diagnose visceral components through simple palpation of the back. Not only that, but it feeds forward efferently as well. When you have a back that is distressed with hypertonic musculature, this can lead to ganglionic dysfunction and lead to something such as an arrhythmia, an autonomic dysregulation in the viscera. On the right, we have the parasympathetics, which we'll also work with today, focusing on cranial nerve 10, the vagus nerve, the wandering nerve. It goes out to most of the viscera, and a large part of the body's parasympathetic system is governed by this one nerve, which we will learn to work with, coming directly out of the back of the skull right here. So we've had our head in the clouds, lots of concepts. This is really about coming down and realizing that all of these things are not just thoughts, they're not just visualizations, they are living right now inside of your body. As you breathe, the fascia moves, the muscles slide over each other, your shoulders relax, and we'll begin to understand this more in depth. We'll start by closing our eyes and placing your hands directly out in front of us. With your palms up, take a deep breath in, and then exhale a deep breath out. Now turning our palms down, we'll do the same. A deep breath in, and exhale a deep breath out. Did you notice a difference? When your palms are down, the lower costal muscles and the diaphragm becomes more engaged. Try it one more time and notice how the air fills the lower lungs. With the palms down, and then turning the palms up, notice how the upper lungs are now filled. Take a moment to appreciate how even the finest change in muscular tone affects both your body and your mind. By simply turning the arms up and down repetitively, it disrupts the mind. It also disrupts the breathing. we can begin to understand these intricate connections. So next, with our eyes closed again, let's take a moment to turn into our autonomic nervous system. Closing the eyes, feeling the body in this moment. Do you find yourself stressed out lately? Or do you have a recurring thought on your mind? Sometimes this expresses itself as a buzzing sensation inside the body, or heightened sense of sympathetic activation, agitation, or a gentle restlessness of the body, the mind, or the spirit. Or maybe you haven't been sleeping well lately and there's a parasympathetic lethargy, a parasympathetic imbalance, an underlying sense of potential agitation as the sympathetics compensate during the day, trying to balance you out. Take note of exactly how you feel in this moment in your body. Are you lusty, lethargic, restless? Is that coffee hitting harder than you thought it might? Allowing your mind to fall from the top of your head, down the back of your head, to your neck, scanning for areas of tightness. Bring your mind down your neck, the cervical vertebrae, the upper back and thoracic vertebrae, down to the lumbar, all the way down to the sacrum. Scanning this area up and down, finding an area that's potentially more tight for you. You can feel this area with your hand, get a sense of the musculature around it. In the surrounding areas, is it different? At this time, I'd encourage you to stand. I'll stay sitting to be in view for you. What we'll be doing is very passively, starting with the very first vertebrae at the top of the head, letting our head fall forward and falling down vertebrae by vertebra through the cervical region, down through the thoracic region, and into the lumbars. You'll notice that each vertebra moves one by one. You may also notice that in some areas, the vertebrae move in groups. This often happens when there's an instability at a single vertebra, and there's hypertonicity as the musculature around tries to support that area. Just take note of this. Maybe it correlates with what you found before, maybe not. Once you have an idea of the area that might be tight, we're going to move on to our direct treatment. So remember, we're balancing the sympathetics. Those little ganglia lie just anterior to every rib head. So what we'll be doing is appreciating the whole body, the living anatomy. And we'll start by using our lacrosse ball or a tennis ball. Some people use their hand. I used a cell phone one time when I was in Guatemala and I had nothing else, a water bottle, anything relatively soft. And we're going to place it directly at that location where you felt the tightness. Trust your conscience on this one. Now, it's best to lay down, but don't place it directly on the spine, on the bone there. That would be very uncomfortable. You want it to be slightly lateral where that hypertonic musculature is. And as you get yourself in position and place your object just there, you may notice, especially if you're using a lacrosse ball, that this can be modestly uncomfortable and different. Acknowledging that, take a deep breath in, filling this area with light. And as you exhale, allow your body to melt into the floor. Inhaling, filling it with space, and exhale into emptiness. Rest here, breathing. Listen for what you've never seen before. Don't look for what you know. Stay empty. Appreciating the whole person. You may feel a change in your whole body autonomic sensation. Maybe a slowing of the breath or the heart. A gurgle in the belly as you rest and digest. The sliding of the fascia, a release of the muscles and other parts of your body. Listening to your autonomic nervous system. And listening to your conscience. By your conscience, you'll know when it's time to move the ball, when it's time to breathe, whether you move the ball to a different area, your mind to a different area, or whether it's the end of the treatment. Some people call the conscience the inner child, or when your will's in alignment with divine will, but you'll know. In your own time, reassess your perceived area of tightness in your soma. However you want, you can passively flex forward like we did. You can feel it with your hand. You can scan your body. Take special note of the overall sense of your autonomic nervous system's response to the treatment. Are you still buzzy? Are you still lethargic? There's a sense here of balance. And in balance is stillness. It's so quiet. It's profound. In our own time, we'll begin to understand the other side of this coin, which is a fully integrated system, is the parasympathetics. And we'll begin to look at cranial nerve 10 and the vagus nerve coming out of the back of the head. Often, as we do, we find ourselves in this upper cross type of syndrome, as it's called, TikTok neck, computer neck, whatever you want to call it, where there is in the anterior compartment this large amount of stretch of the flexors, the deep neck flexors, they become weak. And in the back here, especially the traps, the levator scapulae, and up through this neck, right at this area where the vagus nerve comes out, we'll start noticing a tightness, increased headaches, tension, anxiety. Now, noticing the anatomy here, living inside of you, the vagus nerve comes out of the base of the skull here, following down and innervates such a large part of the parasympathetics of our system. And it's right here where it comes out, where all of that tightness comes together. So we'll be directly playing and experiencing with this. We'll be working in an area called suboccipital area, and we'll be doing a suboccipital release. So feeling with your hand right here at the base of the skull, not midline, but just a little bit to the side, you'll feel bone, 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 and then softness. That softness is the musculature. And right between that bone and softness, there's a sweet spot, the enthesis, where the muscle directly attaches to the bone. This is the part that we will be directly manipulating. So you can see here I have Michael's head in my hands, and simply without force on his part, he's laying there. There's an anterior force of my fingers, which we'll be reproducing again without trying force. This entire thing should be relaxing and not require any muscular activation. There's also a superior force, and we'll see that the combination of these two forces will actually bring the head passively flex forward, just like we did before. I'm not pulling down, I'm just falling down. And notice his chin becomes tucked. It's this activity that opens up the back of the head, opening up that musculature and allowing for full flow and function of that vagus nerve. It's a little precise, and you can see me here. It may take a moment for you to get into that position, but using just this aspect here of my distal fifth metatarsal, or sometimes I'll use my pinky, it feels more comfortable. You can use whatever feels comfortable for you. I place it right at that little area on the suboccipital region. Now, notice there's an anterior force. I'm simply laying there. It just so happens that gravity and my hand is helping make that anterior force. And I create the superior force not by using my hand or stretching my neck or firing anything. I just reposition my hand a little bit, bringing it more superior. And as I bring it more superior, it begins to push my chin down. This will happen automatically without you even trying. Position and then relax your neck, and you'll notice the chin just fall. So let's get in position and try this. Remembering the space between the base of your occiput and your neck, let's focus now on the parasympathetics. Lying down, placing that medial aspect of the fifth metatarsal or your pinky. This is a fulcrum of pressure along this space. Remember, you're just lying there, positioning as you need to until that chin just naturally comes down toward your chest, noticing the increased flexion, relaxing the neck. Again, breathing into this space and exhaling. Allowing your musculature to melt. Following the breath. As your muscles relax. Remembering to listen for what we've never seen before. Watching the whole body, the whole person. Your autonomics. And following our conscience deeper At the bottom of the balance is stillness. Following your conscience. I was once told the end of a treatment is when you see the sunrise. Sometimes a deep breath. Taking note of changes in your senses, of the autonomics. Are you agitated or accepting? Is the mind fidgeting or still? Is the spirit restless or focused? What you feel now is called health. It lights in all of us and comes from within you. Acknowledge it. I'll end with a simple quote by Andrew Taylor Still, who discovered osteopathy. Now you are found worthy to enter the training rooms as an apprentice. Once in the operating rooms, you are in a place where printed books are known no more forever. Your own native ability with nature's book are all that command respect in this field of labor. Here you lay aside the long words and use your mind in deep and silent earnestness. Drink deep from the fountain of reason. Penetrate the forest of that law whose beauties are life and death. To know all of a bone in its entirety would close both ends of an eternity. Thank you.